there are lots of different causes of optic neuritis, but in the setting of multiple sclerosis, it's caused by an immune attack of someone's own white blood cells attacking the myelin coating on the optic nerve. And when that happens, people will experience oftentimes blurred vision in one or both eyes, and then they can have pain with eye movements. Sometimes it's just, feels like there's a missing spot in the center of your vision, or a blurring, or could go completely out. In terms of treatments, the good news is that there are lots of options. When we identify that somebody has an acute optic neuritis, meaning that it's a fairly new and that there's inflammation, typically what we use is steroids, and most classically that would be intravenous steroids, so where you get an IV placed and receive something called methylprednisolone or solumedrol. And that's usually a gram of that once a day for anywhere between 3 to 5 days. And most people notice within a couple days of that they would have some improvement, and then could continue to have improvement for weeks to months after that. Typically we see optic neuritis really in the form of a relapse. So we when we use the term progression, we usually think of something that is slowly worsening over a very long period of time. And so typically in MS, this would be something that somebody would notice these symptoms more of what we'd say subacutely over maybe hours to days, where they notice that there's something off with their vision, and then over a period of a couple of days, maybe even a week or so, they could feel like it gets worse and worse. But then there's a point at which, even without treating somebody with steroids, somebody could then start to improve if they didn't seek medical attention. It just typically, if we give steroids or pheresis treatment in the setting of MS-associated optic neuritis, it accelerates the recovery. But I'll say in terms of progression, it's interesting. I do see people who have primary progressive MS where we know that their symptoms have been gradual since onset. And when I do some of my tests, looking in their eyes or shining a flashlight in their pupils, I can see signs that they've had an optic neuritis in the past, but that individual never had the symptoms noticed acutely, but it's more of something that may have come on gradually or was so subtle they didn't notice.